Welcome back, and you're tuned in with myself, Nafisa Dango, and we're going to be talking to Amanda Seccombe, the founder of Eyes2Eyes. After almost going blind due to Acanthamoeba keratitis, Amanda founded Eyes2Eyes, an NPO focused on various fundraising initiatives to help increase public access to eye care. And Eyes2Eyes actually deals with corneal blindness, which is one of the biggest causes of avoidable blindness globally. In South Africa, many people face extraordinary challenges every day because of eye disease. Their vision is to enable early diagnosis of corneal disease through innovative technology and to assist people with low vision due to cornea disease like keratoconus with access to custom scleral lenses. I think this is so important because this is something where if you don't have your eyesight, it really takes your independence away from you. So a very important topic. A very good morning to you, and thank you so much for joining me on the Nafisa Dango Show. Amanda, lovely to have you on. A warm welcome to you today.
Thank you, Nafisa. Thank you so much for having me. It's a great pleasure to be here, and we really appreciate some airtime on your station, and thank you to the listeners for tuning in.
I think it's all about education and trying to help all these people that are facing these particular challenges and making them understand that there are support structures out there, that there are people out there that can help them make a difference in their lives. And this is where you come into play. Talk to us about your situation that you faced that actually led to you opening up and finding Eye2Eye.
Yeah, Nafisa. So in 2018, I unfortunately was struck down with a rare bacterial infection, which resulted in me going completely blind. So for a period of around 7 months, I was without any vision at all. And it was an incredibly painful condition. So I was literally living behind blackened out windows. I wasn't allowed outside. And it was a huge challenge. Losing your vision is something that is, it's mind-blowing. At the age of 51, I never imagined that I would be in a situation where I needed full-time care for a while. And gradually, as I learned to use visual aids, the challenges faced by the visually impaired communities in South Africa and globally.
Okay, let's talk about, what your situation was like. What did it make you feel knowing that you had your eyesight initially? And then suddenly there's this darkness that overtakes you. I want our viewers to understand what people like yourselves go through with these types of situations. I think a lot of the time we take a lot of things that we have, for example, our eyesight, for granted. And like you said, you had it, and suddenly when it's gone, I can only imagine that type of trauma that you experienced.
Yeah, in fact, just speaking about it and thinking about it evokes an enormous amount of anxiety for me still today. And it's something that I'm still having to deal with on a mental health level. It is a very, very scary process. Your world is suddenly turned upside down. You don't know whether you're going to be able to see again. You don't know what level of care you might need in the future. In terms of employment, I wasn't able to work. I run my own business, and obviously that came to an end. It had enormous financial implications for me, both in terms of not being able to work. I live on my own, and so not being able to work, and the medical implications and costs were enormous in getting me to a point where I started my visual rehabilitation process. And I consider myself to be a relatively privileged person in our society. So it's it's interesting when you go through this experience as a patient, and you start to question, how do people without support cope? How do the people who struck with this sort of condition or with any kind of visual impairment in our rural communities or in areas where they have limited access to eye care, are potentially part of a public health system that where eye care falls very, very low on the pecking order, sadly. We don't receive, in fact, eye care doesn't receive a lot of focus within the healthcare system. Understandably, we have a huge number of other communicable diseases that we are faced with within South Africa, but we need to do a lot of work around increasing, the awareness.
It's interesting, Amanda, that you bring up that situation about the fact that there isn't enough attention put to eye care. But I think it's about creating the education and awareness to the level of government to say that, you know what, your most important thing that you need is your eyesight, because if you don't have your eyesight, you literally don't have your independence. There's absolutely nothing that you can do. And I think maybe that's where we need to start from eye to eye to be able to, you've created an amazing platform with Eye to Eye to be able to bring light to the situation of course, corneal issues and many issues that refer to the eyes as well. But it's also going out there and I think creating that awareness for people to understand the importance of bringing light to that particular situation and creating support structures besides yourself. So what sort of networking has Eye to Eye done? Because I know you've been dealing with corneal blindness and keratitis, which I think is very important because people don't realize what sort of impact that has on society and on individuals being able to actually move forward in their lives.
Exactly. Keratoconus is a condition that often can be fixed with a scleral contact lens. And at state level, for example, there is no provision made for scleral lenses. Hence, us stepping in to try and facilitate a program. But long term, to make this sustainable, we need to advocate for change in policy where that's concerned. And we are certainly, that's part of what our goal. We're new at this game. We're 3 directors who are literally coming at this from sort of a very, very much a heart space. We do all have business experience as well. I have personally undertaken to study this year. I'm doing a postgrad in community eye care, so I'm learning a lot about not just eye diseases, but also about the mechanisms of advocacy. So really getting myself in a position where I can take that sort of challenge up as well. On a regular basis. We are networking already with organizations globally. I follow a number of organizations, the International Agency for the Prevention of Blindness. I attend as many webinars as I can. And locally, we're slowly getting our name out there. You know, it takes time. We're obviously lobbying pharmaceutical companies for changes to some of things like contact lens solutions, for example, need to come with a warning about water. That was, in my case, my condition is a waterborne bacteria.
Right.
And so there are things that we can do from that sort of level, but on a bigger picture level, in terms of advocating the Ministry of Health, yes, there's a lot of work to do there. And that process is just beginning for us.
I'm glad that you've actually, started that process, because as we're saying, there's many people, not just yourself, that are suffering with this particular situation. And as you say, with keratoconus, it's something that you can fix. So why not give people back their independence, give them back their integrity, give them back their eyesight, so that they can be independent and they don't have to go out and try and look for grants and things like that in order to be able to support themselves. But it's also about what I found interesting is that you've now gone and bought the confocal microscope, which I think
not yet.
Not yet. Oh no, okay. Have you not received those funds as yet?
No. That's a big expense. It's a big capital expense.
What sort of expenditure are we looking at?
Probably to the tune of R1 million. It's an expensive piece of kit, but we don't have one in the Western Cape at all. In fact, there is only one in South Africa, and it's in Joburg.
Wow. Sure.
And apart from it being important in diagnostic and screening purposes, it would be an amazing vehicle for us to then drive fundraising. So any money that comes in from the use of that microscope, whether it's in public sector or in private sector, would be channeled straight back into the sterile lens program. So we can roll it out that way. So we're very, very keen to get that in place. But in the meantime, we want to get whatever funds we have got allocated to sterile lenses, and we're very excited because we've got our first few patients being fitted.
Wow.
So the start of that process is going to kick off. That, as you say, it's life-changing. You can't. It's about education. It's about being employed, and this eyesight is so important. And in terms of the burden to the state, from a disability grant point of view, it's exactly that. If you actually had to quantify that versus, the cost of giving somebody access to either cornea transplants, scleral lenses, whatever eye condition, the treatment that they need, it's a no-brainer. Treatment wins, and avoidable blindness is very, very important.
Amanda, how important would you say is it from Eyes2Eyes point of view to actually go out there and create the awareness and the education? Because I think a lot of people are not, should we say, tapped very well into this particular issue that is happening and people that are experiencing it. Do you think it's important for your company to maybe start creating little awareness programs throughout certain areas? And as you were saying, bring light especially to the rural areas where people are suffering with many different illnesses, and including this. And it's so important, as I said. I mean, we've had a gentleman who had burnt recently, and he's lost 50% of his eyesight due to saving people in the rural area where there was a shack on fire, and has now lost 50% of his eyesight. This is why I'm saying, and to date, struggling on to get the necessary help. He has in some way, but not in many directions. So I would say, I think the most important thing right now, firstly, is, of course, bringing light to the situation and making people understand that there is, of course, a void as far as this is concerned.
Yeah, there's a huge amount to be done around that. We run awareness campaigns on our social media platforms, and we are also trying to create a situation on our website where we have resources for people who have varying degrees of low vision or blindness. So whilst we're focused on cornea disease as an organization, we want to actually get together a central resource base for people who have problems with their sight. We will never say no to a request from somebody outside of cornea, and we want, I think it's important for all of the organizations to start working together so we can create sort of joint awareness. And awareness is, it's about the fact that there is help out there. It's about the fact that things can be done about certain eye conditions. Often we find there is an acceptance of blindness, particularly within our rural communities. There are lots of myths around why you go blind, for example. So if you lose your sight, there are thoughts that, well, this is something that's just visited upon you and you must live with it for the rest of your life. No, that's not true. There are very often things that can be done. Unfortunately, those things can't be done quickly at the moment in this country. There's a real backlog in terms of eye care.
Yes, most definitely. And I think that's what they need to look at, is how we can take it from there. So from Eyes2Eyes, where do you see yourself heading to in the future, and how do you intend changing those particular lives in the rural areas, especially because, as we know, there is a huge hole there?
Yeah, well, I think long term, what we want to be able to do is we want, first of all, from a cornea point of view, we want to start seeing the procurement of cornea tissue within our own borders. That's going to be a major impact on cornea-related disease. We currently are net importers of cornea tissue at great expense. So somebody living in a rural area who can't access treatment is going to find it very hard to get a cornea transplant should they need a cornea transplant.
Right.
We haven't at the moment got outreach services in place, but eventually that would definitely be something we would look at as we grow, is being able to actually access these areas. You know, there's so many barriers. It's about distance. It's about getting into these communities. Corneas, unfortunately, are very, very specialized. So we need the services of very, very highly skilled ophthalmologists in dealing with corneas. But there is some exciting work being done in terms of technology. Mobile device access to diagnostic screening, for example, and hopefully, you know, we follow all of that. At the moment, it's limited to things like glaucoma and cataract screening and diagnosis. But you know, things are happening out there on the global playing field in terms of technology, and we hope that we will be able to tap into that for corneas as well, to enable us to get into those rural areas and communities.
You know, there's one important question I wanted to ask you is, what is it that you have done? And I want people that are in your situation to understand this, is to get yourself out of the situation that you were in and help yourself. What is it that they can do? People that are finding, besides the support structure, themselves in a situation like yourselves, to be able to go out there and find that help, and of course, work on that positivity as well.
Wow, that's a big question. Yeah, I am very frank about the fact that this has been an incredibly emotionally and mentally challenging situation. And I understand that, and I empathize with anybody who is going through that situation. But you have to hang on to hope. And I think having somebody to talk to and having somebody who understands your situation is very, very important. Be that a low vision service person that you can connect with, be that me that you can connect with. I have communication with a number of people, not just with cornea related conditions. I check in with them, we chat on the phone, and it's literally about encouragement and knowing that you're not out there on your own. You have to dig very, very deep. For me, that's been connection to my spirituality in a sense. I've been fortunate in that I've been able to use audio resources a lot for motivational connection. So I listen to things like podcasts. I listen to YouTube channels. I'm also a big fan of music, and I listen to a lot of music. That eases tension for me. It eases anxiety. And funnily enough, it's also part of our fundraising initiative. We use it. We use music a lot in our fundraising. So I think the advice that I would give to people is, don't lose hope. There are extraordinary things that you learn through this process. You do tap into other sensory, not solutions, but I mean, you know, you tap into your other senses enormously. You learn to appreciate your taste, your touch. And you are definitely gifted with things that other people will not necessarily experience. For a long period in my blindness, I had an enormous sensory and auditory enhancement in a way that was quite extraordinary. So you learn to utilize those resources, and don't be frightened of low visual aids. Don't be frightened of getting out there with a walking cane. You would be surprised at how people respond to you. Reach out for help. When it comes to things like shopping, talk to your your grocery store person about the fact that you're visually impaired. Let them walk around the shop with you if you want your independence, but you still need some help in selecting things like your everyday groceries, because we do want a sense of independence. We still want to be able to go out and do things, but don't be frightened of reaching out for help. For a long time, I hid away, and I was very isolated. You become very, very isolated, and that leads to depression and makes life even harder.
I so agree with you there. What last words would you like to leave us with this morning for our viewers?
Yeah, I think for everybody, just know that within you, there is an incredible resilience. There is an incredible amount of strength. We all have it within us. I would never, ever have thought that I would be in this situation. And I would never, ever have thought that I would have had the strength to start this foundation and to be seeing real positive change and be an agent of change. I didn't ever imagine that my life was going to be a life of service in a way to people. And it has brought me to a place of enormous gratitude, but also an acknowledgement of my resilience and a big acknowledgement of our need for self-care. Look after ourselves.
Interesting. Definitely an inspirational set of words to make us understand that you've definitely been a role model to people that are in this situation, and a true inspiration to say that you can keep the positivity and you can change your life for the better. Talk to us about the Mandela Day project.
Thanks, Nafisa. So yeah, we were trying to come up with a concept to fundraise on Mandela Day, and yeah, Madiba is obviously very close to all of our hearts and such an inspiration. His own life was such an inspiration. It also just struck me when I was trying to think of concepts that he also experienced eye problems. He had cataracts and he had cataract surgery, but he also experienced glare issues, which I experienced as well. And yeah, that's something that we need to talk about maybe on another platform. But yeah, glare and screen time and all the rest is a big issue in eye care. So for the Mandela Day challenge, what we've decided to do is ask people to take 67 minutes out of their day, do something that they enjoy doing, but wear a blindfold. And during those 67 minutes, see how things turn out. Do something that you love. It will get messy. It always does when you are not used to not being able to see what you're doing. So maybe do it with your family and have a little bit of fun around it. And I don't say that in any way to discount how hard it is to be blind, but let it get messy, because life is messy when you can't see,
I so agree with you. I agree with you, because the thing is, I always say one thing is that people will not understand what it is that you're going through, what you're experiencing, until they themselves experience it. And it's such a phenomenal idea that you've come up with, because, I tried it one day, and it's not easy. With an NPO, we tried it because they were doing stuff with cataract, and just putting the blindfold over for a few minutes. It was such a difficult situation that I found myself in, and I think this is what people then start relating to, and that empathy level comes in, where they start feeling the empathy for the people that, like yourselves, that are in that particular situation, and then want to reach out and try and help them make differences. So I think it's a phenomenal project for all of you that are listening out there. We're saying do join Amanda on Mandela Day, get involved with the project, and make yourself understand the type of experiences people with these particular eye issues are going through, and let's start making a difference out there. And I think that's what it's all about. It's about creating these support structures, the Ubuntu that we all believe in South Africa, and saying, let's get together, let's join join hands and try and make differences in many directions. And Amanda, if people would like to support your campaign and your project, and of course everything else that you're trying to do for those others out there that you want to reach out to, how do they get a hold of you?
So they can find us on our website, which is www.eyes2eyes.org.za. On Instagram, our handle is hashtag Eyes2Eyes2020, and the same on Facebook. We're also on Twitter if you're a tweeter. That's something I'm still getting used to. Or you can contact us via email on info@eyes2eyes.org.za. Reach out to us in any way you can.
Most definitely. And I want to thank you for joining us. Definitely a very inspirational person. We want to commend you on being so positive and being a role model to others out there that are finding themselves in similar situations that you're in. And we're also appealing to all our viewers to say, join Amanda in making that difference, not just only on Mandela Day, but every other day after that. Thank you so much for joining us, and do take care of yourself and stay safe.
Thank you, Nafisa. You too. Bye-bye.
Bye-bye. That was Amanda from Eyes2Eyes talking to us about the different types of issues people are facing through their corneal blindness as well as keratoconus. And I think it's important for us to actually go out there and see the, of course, if we lose our eyesight, we've definitely lost our independence. So let's go out there and try and give people their independence back and give them a second chance at life. So we're going to go for a quick break. We'll be back with you in a minute.